Well, hi everyone. My name is Jessica Barker, and I am one of the Academy for Eating Disorders Social Media Committee co-chairs. And I'm just really excited to be here today talking about ICAT. I've got some people with me who are going to introduce themselves.
Hi, everyone. My name is Kelly Borton, and I am the new Facebook Live coordinator for AED.
I'm Dr Wonderlich. I work at Sanford Health and at the University of North Dakota Medical School.
I'm Morgan Sorby, and I am the coordinator of the ICAT Learning Collaborative.
Well, we have asked these lovely people here to talk to us today. Dr. Wonderlich is actually the Chester Fritz Distinguished Professor at the University of North Dakota School of Medicine and Health Sciences. He serves as the Vice President at Sanford Research. He's also the co-director for the Eating Disorder and Weight Management Center at Sanford Health and also the Sanford Center for Biobehavioral Research. He's published widely in the literature, and he currently sits on the editorial board for several professional journals. He's a past president of the Academy for Eating Disorders, was a member of the Eating Disorder Work Group for the DSM-5, and he serves or has served on the board of directors for several eating disorders organizations, including the Eating Disorders Research Society, the Academy for Eating Disorders, the Eating Disorder Coalition, and the National Eating Disorders Association. But why I know him best and why he's here today is to talk about a new therapy that he has developed along with Dr. Carol Peterson called Integrated Cognitive and Affective Therapy, typically called ICAT, right, Steve?
Correct.
Well, why don't you tell us a little bit about it? What distinguishes ICAT as an eating disorder treatment?
Yeah, no, Jessica, it's a good question. And thanks for your interest in ICAT. And we're excited to hopefully learn as we teach more people about it, but also just to get it out there and let people use it because we think it can be helpful. Broadly, what distinguishes ICAT is a little more of a significant focus on emotional processing in the eating disorder patient. We were doing some research where we learned that in the moments before eating disorder behaviors, binging, purging, restriction of food, exercise, people's emotional states deteriorated. And then after they engage in the behavior, their emotional state sort of improved. And so we, Carol, myself, other colleagues at the University of Minnesota and here at Sanford, we began thinking about what that means. And we then decided, we're clinicians, let's build a treatment. Let's see if we can take advantage of what we just learned. And so we built this treatment, which focuses on emotional states and their relationship to eating disorder behavior. And that's a major focus. But we also are trying to figure out what is it about the eating disordered individuals' behaviors, cognitions, way of being that makes their emotional states so complicated and difficult. And so we spend a lot of time looking at the way they relate to themselves, the way they relate to other people, the way they relate to food. And it really takes that focus where we're trying to understand the emotional world of the eating disordered person.
Oh, and I'm muted, of course. That's just what a wonderful explanation and description of the therapy and how you developed it. Thank you.
Thank you.
Yeah, thank you so much for that description. And I was wondering, you talked a lot about kind of the internal emotional state. What are some of the research outcomes that you're looking at with this treatment?
Yeah, and we appreciate the opportunity to talk about that because, you know, we are clinicians, Carol, myself, the other people involved. We were all clinicians, but we're scientists as well. And so, you know, we base the treatment on scientific findings that we learned in our studies. But then after we built the treatment, we did 2 randomized controlled trials. We did one in bulimia nervosa, and we did one in binge eating disorder. And in both of these studies, what we found was that ICAT and the comparison condition, the other treatment, both actually were equally effective in terms of helping the eating disorder person with their recovery. But importantly, in both conditions, there was just a great chance that the person was going to get better, make significant improvements. And so what we learned was our treatment wasn't necessarily any better than the others, but it was equal to, and important to me as a clinician, it worked well. Scientifically speaking, there's something that we call significant effect sizes in terms of change. So people were changing their behavior and really getting better. And that's the good story that we're trying to tell about this, is it's something to put in your toolbox to help your patients.
Well, that's great. I think every clinician really wants as many tools as possible, and really so important to figure out what tools feel best for us as clinicians. I'm a therapist, and I know I always want to have something that I feel comfortable using. And what I wondered, and I think other people would too, is who then would be the best candidate for taking your training? We are offering one through AED coming up. So who would most benefit from adding this tool to their toolbox?
Well, yeah, what we're thinking is that, I mean, these are really eating disorder specific treatments. They're short-term structured treatments. They last about 5 to 6 months, at least the way we did it in our studies. And they're very specific to eating disorder psychopathology. So the people that would most benefit, I think, would be people who are a significant proportion of their clientele are eating disordered. If you only see a couple of eating disorder patients a year, I mean, you might be interested. But for people working in an eating disorder center where this is what they do every day, that's the ideal candidate for the training, I think. We're saying that people need to have at least a master's degree, they need to be licensed, and they need to have a significant fraction of their caseload be eating disordered patients. So that's the best fit. The other thing, and we'll talk about the learning collaborative, but we're going to try and create a learning community where people come together and we talk about eating disorders, we talk about recovery, we talk about this treatment, and we try and give people really practical clinical techniques to utilize. And so if that kind of resonates with you, if you're somebody who wouldn't mind being part of a group that's really working on this, that's icing on the cake. I think that would really seal the deal for me.
Thank you so much. That's wonderful.
Yeah, thank you so much, Dr. Wonderlich. And I was actually wondering, I'm a dietitian, and so I really appreciate learning all of these things that are happening on the treatment and psychological front. It's all very interesting to me. And is there anything else you just would like the followers who are watching this to know about ICAT?
Well, it's not perfect. We're going to keep working to make it better, and we're already thinking about that. We're pretty pleased with the results we've gotten so far. We kind of like the way it feels when we do it. And in the first trial, we had 80 bulimic individuals receiving treatment. And in the second trial, we had 112 binge eating disorder patients receiving treatment. And one of the things that the clinicians in the trials told us was that ICAT did feel different than like cognitive behavior therapy when you're delivering. It's just a different model, a different approach. And when we've done trainings around the US and frankly now around the world, clinicians who work with eating disorders often say to me, this kind of feels like what I tend to do, but it's a little more systematic. And so for the clinicians, there seems to be a resonance, which is good. I think the only other thing that I would come back to is just to highlight, this is not just going to be a webinar. It's not just a workshop. The part that we think is a good thing is that we'll do 6 months of consultations with participants. And it'll be alternating. There'll be 2 groups going every other week. So twice a month, every participant would have a 1-hour consultation call where cases would be presented and discussed, and we'd all learn. And in our minds, that's the best way to learn these sort of multifaceted, sort of complex treatments, is to give it time and to be able to consult and confer. So for us, the Learning Collaborative is just a great strategy. So beyond that, we're just looking forward to getting to know some people and learning some new things.
Oh, that sounds really great too. I love what you said about it. Just really feels natural for the clinicians that have been able to learn from you and start implementing this into their work. And I'm wondering too, what about the clients or the people that have participated in the trials? What are they saying about it?
Well, we actually measure that. We measure how the participants do clinically, their symptom improvement and their changes. We also ask them to rate various components of the treatment and how helpful was it and how did you like it. And we have learned some things that we didn't expect by that. There's particular things in the treatment that we didn't realize how much our clients might really find that useful. And they told us, no, this was really useful. And so we've turned our attention to some of those things to try and make them even better. Overall, though, the participants in our studies have found it useful. They like it. It made sense to them. They felt it was flexible. Some found the emotional focus to be difficult, which we anticipate. But others find it, in the end, I think, very useful to make that a part of their life that they can try and figure out.
Exactly. I think as clinicians, the best thing we can hope for is to have as many different tools in our toolbox as we can have, because we know that no one tool works for everyone. So having something that both feels good to us to implement, as well as that feels really good to anyone that's looking for help with their eating disorder is really what we're all here for as clinicians and researchers in this field. So, well, we're just so excited to be offering the opportunity to engage in this learning collaborative. So for anyone that is interested in learning more about it, I know they can visit the AED website, right? www.aedweb.org. And Morgan can tell you a little bit about her role in the Learning Collaborative as well.
Yeah, so when Steve was talking about the consultation calls, I will oversee those. And then I will also collect data and answer your guys' questions throughout the way too. So don't hesitate to reach out.
Awesome. Well, for anyone who's really interested in learning either more about ICAT in general or about learning about the Learning Collaborative, what can we tell them to do for the next steps?
Morgan, where do they go?
They can go through the AED website and then submit their application to us. And then it comes to me, and then we'll look over everything after the April 1st deadline and then get back to people.
Wonderful. And feel free to reach out on any of our social media channels as well if you're seeing this through there, and we can get you more information. Well, thank you all for coming today, and I just really appreciate it. And we will talk to you all soon about ICAT again, I'm sure.
Thank you. Thank you both.
Thank you.